Welcome to Mental Health Matters, a compelling series brought to you by Ontario Shore's Centre for Mental Health Sciences. Every week, we share stories of hope, recovery, and resilience, accompanied by expert advice and resources to help navigate and understand the complexities of mental health. Situated on the shores of Lake Ontario, Ontario Shores is a dedicated public teaching hospital. We provide specialized assessment and treatment services for those living with complex and serious mental illness. Our unwavering commitment to exceptional patient care is built on safe and evidence-based approaches, ensuring successful outcomes through clinical best practices and cutting-edge research. From adolescence to geriatrics, our recovery-oriented environment fosters discovery, recovery, and hope. Mental Health Matters is an opportunity for all of us to learn, grow, and support each other on this journey of well-being. Each episode focuses on breaking down the stigma surrounding mental health through crucial conversations and fostering empathy within families, schools, workplaces, and communities. Join us as we embark on an exploration of the topic of mental health. Together, we make a difference.
Welcome to Mental Health Matters. I'm your host, Julie Van Hardingsveld. In today's episode, we're shining a spotlight on women's mental health and exploring the transformative impact of the Specialized Women's Clinic at Ontario Shores. Today, we have the privilege of hearing from two exceptional members of the Ontario Shores team and two former patients of the Women's Clinic. Together, they have agreed to share their unique insights with us and the significant impact that the clinic has had in their personal journey towards recovery. Please join me in giving a warm welcome to our guests who will share their perspectives and experiences at Ontario Shores. First, we have Grace Shim and Bernadette Ferreira. Welcome, Grace. Welcome, Bernadette. Thank you for joining us in today's episode.
Thanks for having us.
Before we get started, perhaps, Grace, you can share a little bit about yourself. We will allow Bernadette to introduce herself and her role, but perhaps you could segue into the relationship between the two of you professionally working together.
Okay, so my name is Grace. I have been a patient with Ontario Shore about 2 years ago due to my mental health postpartum, along with prenatal depression. And I was blessed and I was referred to Ontario Shores by my doctors. And I ended up meeting an amazing therapist, Bernadette right here. And for me, previously, before Bernadette, I had encountered many therapists, but it wasn't a good match until I got referred to Ontario Shore and met Bernadette, and it's been life-changing. She is my inspiration, and she is my light of hope.
That is a really wonderful introduction to Bernadette, and I'm really happy that you touched upon going through a number of mental health professionals, not necessarily finding the right fit, and then eventually ending up with Bernadette. Bernadette, will you share with us and the audience what is your role specifically at Ontario Shores and your connection to the Women's Clinic?
Sure. So specifically at Ontario Shores, I am a registered social worker. And with the Women's Clinic, my role there is to provide psychotherapy to clients that are referred to us. So I provide supportive counseling as well as psychotherapy.
Excellent. A really important role. Again, we're happy to have you both here today. Grace, I know you touched upon the fact that your doctor had referred you to Ontario Shores. Can you share with us a little bit more specifically on your journey to being connected to Ontario Shores? Perhaps someone may be listening or watching from home that is experiencing something similar to what you were experiencing and looking for what those next steps could be.
Of course. Well, for me, I've been going through a lot of mental related illnesses such as depression, anxiety since I was young. But in my culture, talking about mental health is heavily looked down upon. It's very stigmatized. And I think the stigma the social stigma led to self-stigma, and I never actually opened up about my mental health struggles. And over the years, it just got worse and worse until I guess it snowballed into something bigger. And having children as well with postpartum, it just got really difficult, and to a point where I had to be admitted to the hospital. And I was hospitalized too several times, due to the mental health struggle. And eventually I was referred to Ontario Shores, and that's where I started my treatment. But it was really hard keeping it in, keeping my mental health struggle a secret. But after meeting with Bernadette, I'm very open about it. And, working as a nurse, I see a lot of stigma towards mental health patients as well. So for me, it was really hard to open up even more because of my job. And I was scared that if I open up about my mental health, I'll be getting into trouble at work, or my coworkers will look down on me, or I might lose my job. And I didn't want others around me to know that as well. Because again, going back to my cultural root, it's very stigmatized, and mental health is seen as a sign of mental illness is seen as a sign of weakness and something I can just overcome. But it's not. It's a struggle.
Absolutely. Thank you for sharing that. Bernadette, could you elaborate on the importance of the offerings of the specialized care at the Women's Clinic, and what makes or separates the Women's Clinic from other clinics or programs that you may see, whether it be at Ontario Shores or other organizations?
Okay, so I don't know if most people are aware, but anxiety and depression is one of the most common medical conditions in the perinatal period, and that period is from point of conception up to 1 year postpartum. And so early detection and treatment is key for women and baby. So in our clinic here at Ontario Shores, we do support women struggling with perinatal mood and anxiety disorders. And so what they'll receive here at the Women's Clinic once they're referred is they'll receive an initial psychiatric assessment by our nurse practitioner or our psychiatrist. They'll be provided with a diagnosis, treatment recommendations, as well as medication management and optimization if needed. But most importantly, they'll also receive supportive counseling and psychotherapy with either myself or my colleague. And that is something that a lot of women, unfortunately, are not receiving supports in the community around their perinatal mental health.
What are the steps? Is it an inpatient clinic, an outpatient clinic?
It's actually an outpatient clinic. Yes. So we provide short-term, manualized, focused psychotherapy in our clinic. So anywhere from about 16 to 20 weeks.
And is a referral required?
So a referral by any healthcare practitioner. So that could be your family doctor, your OB, it could be a public health nurse, a mental health counselor in the community.
Excellent, excellent. So a lot of ways to embark on the pathway to receiving care. Is there wait times?
There are wait times, unfortunately. So I would say anywhere maybe from around 6 to 8 months.
Okay.
Yeah.
So important to start thinking about. Grace, I know you've really touched on many elements of your journey to recovery. When you think about your time at the clinic or working with Bernadette as part of the clinic, what stands out the most to you as the most transformative piece to the care you received?
I think for me is opening up my mental health and not being afraid to talk about it and being open to receiving help. And Bernadette really opened that up. And not only that, mental health recovery is not like physical recovery. It's a long, long process. And, I had hiccups and bumps along the way, but what really sticks to me is that Bernadette told me that one step back is 2 steps forward. And I always live by that. And before, when I hit the bump, I got really discouraged, but that word, 1 step back, 2 steps forward, really stuck with me. And every time I feel discouraged about my recovery process, I just say that out loud.
I'm going to talk about the bump. So a bump in the road could be something like not finding the right therapist, or maybe trying or meeting with a therapist or a mental health professional and saying it doesn't work for me. What suggestions, Bernadette, do you have for someone who may have experienced that?
To never give up, right? We may not always find the right fit in life. And so it is important to continue to talk about your mental health, to continue to look for supports, to speak with your family doctor, to speak with someone within your circle of care to help to find that right support and service for you, most definitely.
Excellent. I'm going to switch gears a little bit before we wrap up. Considering that there are wait times, which is inevitable, unfortunately, in the sphere of mental health we know right now, especially. Grace, what are some early signs and symptoms that someone may be feeling or recognize in a friend or a loved one or a family member that may indicate that they should be speaking to a professional about their mental health?
Thank you. I'm glad you asked that. So for a lot of women, irritability, sensitivity is very looked down upon. And I guess this is due to lack of focus on women's mental health because, women present mental health differently than for men. But yes, going back to that, it'll be irritability, sensitivity, withdrawal, isolation. And that is an initial sign. And if you see someone, one of your girlfriend or mother or sister or your wife having those symptoms such as irritability, sensitivity, it's not because they're mad at you or anyone else. It's because they're going through something internally. And that's when the loved ones or the family or friends around them need to ask if they're okay and see if you can provide help for them. Because it takes a community, really, to help one another out.
It does take a community. Bernadette, do you have anything to add to that?
I think Grace actually really hit the nail on the head with that one. Definitely irritability, the mood swings, lack of sleep, the withdrawal and isolation. Those are probably one of the biggest ones that we would identify.
Grace, what's next? We have had the privilege of working with you as a tremendous advocate for not only mental health, but for the Women's Health Clinic. You participated in a number of events this year. Were on our show last summer. Besides being so grateful for the advocacy that you provide our organization and mental health in general, what's next for you? What are you working on?
First of all, I'm very humbled and honored to be part of this. I want to contribute more as a mental health advocate. For me, my goal is to become a nurse psychotherapist. So right now I'm bridging to registered nurse right now so that I can open up my own scope of practice and go into the root of mental health. And I'm also thinking, I also have an Instagram account, nurse.graciegrace, so I can open up about my own mental health struggle and relate to the others in the community as well. And I'm in the process of creating a podcast with my girlfriend, but that's still in the working process. But follow me on my Instagram account, nurse.graciegrace, and hopefully we can start this journey to recovery together.
Yes, definitely. I think there's a number of areas that you really bring some tremendous advocacy to mothers, to those who may face cultural barriers to seeking mental health treatment, as well as just community members, students, nurses, first responders, frontline. You really are a beacon of hope for so many individuals. Thank you so much. And thank you, Bernadette, for joining us here today as well and offering your insights.
Thank you again.
Welcome back to Mental Health Matters. In this segment, we're continuing the discussion around the Women's Health Clinic here at Ontario Shores, and we're focusing on the importance of tailored mental health care for women. I have two esteemed guests that I'm so happy and humbled to welcome. I'm going to allow them to introduce themselves and their connection to Ontario Shores and one another. Welcome to both of you, Piyushi and Kathy, welcome. To get us started, Piyushi, I'm going to ask you to start us off. Perhaps you could just share a little bit about yourself and your connection to Ontario Shores.
Sure. I'm a writer and an author, and now a mother of two. 7 years ago, my journey, the mental health journey began 7 years ago when I became a mother for the first time. And I was looking forward to the experience, but I had a very traumatic birth experience. I did not realize it at that time, but it changed the course of my life. all I would see was I was an angry woman. I was not able to connect with my child. All my relationships were deteriorating. I was not being able to connect with myself. I would cry for hours. I didn't know what's wrong. I could just see that something was very wrong with my life. It took me, unfortunately, years before I reached out and asked for help. I think it was when my son was about 4. I reached out to my family doctor and said that I think I want to have another baby, but I am petrified. I think I did it so wrong the first time. I don't know what I should do. And that's where Ontario Shores came into my life. I was referred to Ontario Shores and I started treatment with Kathy. She changed my definition of myself. She helped me see that I had been suffering from post-traumatic stress disorder, from postnatal depression, and how those were affecting my day-to-day decisions, my behaviors, my feelings towards things, and how I had come to be defined by what had happened to me. She also helped me change that definition in my mind. I was once again able to look at myself in a mirror with confidence, offloading so much of the guilt I had been carrying for years. I learned to reframe and call myself a good mother from when I introduced myself to her and said, I'm a bad mother and I'm doing this all wrong. She gave me lots of tools and resources to manage my anxiety, to overcome my fears, to live my life better, to heal my relationships with everyone around me and with myself. This has been my journey with Ontario Shores and with Kathy.
Thank you. We'll come back to you with a couple of questions, but thank you for sharing that. And I imagine there are so many women listening or watching that can resonate with exactly, I know I can resonate with what you're sharing, and they may not be brave enough to share that and identify with that. And I think hearing it from another mother is really impactful and important. So thank you for sharing that. I'm going to turn it over to you, Kathy. I know Parishi shared a little bit about your connection to one another, but maybe you could share with us what your role is at Ontario Shores, a little bit of your career journey and your connection.
Okay, so I'll begin with my current role. I'm the registered nurse in the women's clinic with Ontario Shores, and we are also the Shoppers Love You Women's Clinic at Ontario Shores. Piyushi is one of my clients, so I work as a clinician in the clinic. For 30 years I worked with Ontario Shores, so it's been a long time building to this point. So I'm working with women now in the psychotherapy role. So I provide ECBT, which I think you started with, right? I also provide interpersonal psychotherapy and cognitive behavioral therapy. And I work with a team of interdisciplinary team. So we have a nurse practitioner, Julie Bisson, and we have Dr. McKeever as our psychiatrist. And you met Bernadette earlier in the segment.
Excellent. You said some acronyms that
I'm
I imagine.
sorry.
No, that's okay.
We're known for those. Yeah.
We sure are. Perhaps to refocus back to that, you talked about different treatment. Maybe you could expand on the use of technology and specifically in the Women's Mental Health Clinic, but also in Ontario Shores in general.
Absolutely. So certainly changing the future of mental health. We began actively using it in the beginning of the pandemic, soon before I met Piyushi. So when the pandemic actually began, we had already had access to OTN services for years, but we hadn't had a lot of clients that wanted that service. And it really progressed during the pandemic. Within a day, we were flipped over to sitting at home, creating our therapeutic environments for our clients from that setting, and we continued throughout the pandemic and to today, providing that care with some return of on-site services. As yet, no one has actually taken us up on, but the technology is through the Ontario Telehealth Network. We provide manualized therapy in the through video chats. So we send out a invite, and the clients log in on their end, and they're home safe with their babies during the pandemic. That was, I think, the saving grace for a lot of moms you've mentioned. So during that time, we meet weekly.
Thank you for that, Kathy. My question now is to you, Piyushi, regarding technology. So how did the use of technology contribute to your recovery journey?
I think technology made my recovery possible to a large extent. At the time I was working with Kathy, we were right in the midst of the pandemic. During the course of the treatment, I did conceive and I was expecting my baby. In fact, I was going for medical appointments. My husband could not come with me for those. So I could not have come in person for therapy, given the restrictions, health restrictions we had. So it was a big blessing. I was able to meet with Kathy online weekly from the comfort of my home. And she never let technology be a barrier. It never felt like she was. I remember when we finally ended the treatment, and for our very last session, I asked Kathy that, can I come in and meet you? By this time, my baby was 6 months old, and a lot of the pandemic restrictions had receded. I met her for the first time in our very last session, but it didn't feel that way until then. I felt like I had known her. Another thing I'd love to mention about the technology aspect is on the day of my delivery, hours after my cesarean, I was lying in the bed in the hospital when Kathy reached out to me. She connected with me a few hours after my baby was born. She allowed me to walk her through what my feelings had been, how the birth had gone. And till date, I feel that just because she helped me process the cesarean a few hours after it happened, I was able to walk out of that hospital already leaving behind so much that I could have carried with me mentally.
As I've shared with you, being vulnerable and sharing your story is so important, but I think it's also so nice to hear recognition and acknowledgement to our incredible staff, which we have so many incredible staff doing such meaningful work, and connecting with a patient so soon at such a critical time, I think is really notable and so special. So thank you for sharing that. And I can't imagine that you guys had not met in person, because I'm not sure how well it's conveyed over the cameras, but I can feel such a lovely connection between the two of you. It's really special, and it's so nice to see. A question for you, Piyushi, as a mother, or even as a woman, not necessarily a mother, and considering the unique approach and resources available through the Women's Clinic at Ontario Shores, what advice do you have for other women who might be hesitant to seek help, or maybe experiencing something similar, some of the same feelings that you had?
Sure. I think after having lived through these experiences, the biggest advice I give, or I would give another mother, is to seek help. And sometimes we don't realize that we need it, and we don't realize that we need it because we don't realize that we are not okay. So one of the things I say to any new mother that I now speak with, I say that I know the world expects you to be smiling and to be really happy around your baby and to be delighted about becoming a mother. But if you're not okay, if you're going to the bathroom for a few minutes for yourself, if you're crying, if you're flustered, if you're overwhelmed, it is okay. It is okay, because we were not born mothers. We were not trained for the job. Overnight, you find yourself in charge of a human life. You're expected to know a host of things, including breastfeeding, which is supposed to come naturally to you, but doesn't. And it is okay if you're overwhelmed, and it is okay to not be okay. And I think when we're able to accept those feelings is when we can possibly reach out and let someone know that we're not okay and we need to speak to someone. It took me years to ask for help. I wish for that younger mother's sake that I had reached out sooner. The trajectory of my life might have been different. I might have made lesser mistakes. But even if it has been a while, even if it has been a few years, reach out for help, ask for help. There is so much out there. So many women do not know about the Women's Clinic and about Ontario Shores. And I have seen on local Facebook forums, mothers reaching out to other mothers and saying that I am experiencing something like this and I think I need help. What do I do? And that's when I realized that I wish there was more information out there, so new mothers knew where to go when they needed help.
Well, thank you for getting the word out and sharing your journey with other mothers and the community in general. I think something that you said to me that really stuck out is it's okay to not be okay. And I know we hear that all the time, but I think we need to, as mothers and as women, really hear that. Like, it is okay to not be okay, and seek help early. Yeah. Kathy, as we start to wrap up this segment, do you have anything more that you would like to add?
I think congratulations is something I want to say to Piyushi, because you went miles, you took everything and worked so hard at it. And I think just to come to the realization that you were always a good mom. And I think looking back, it was interesting to see, to look back and say, I look now and I can actually see I was smiling,
Yes.
and you don't even feel it at that moment.
Yes.
So when you do come for help, that is a big part of it, is getting over that stigma. It's important. And the way you look at yourself as a mom. And that's probably the most rewarding part of being in the position that I'm in, is to see the moms accept that, I am a good mom, and
Certainly.
I didn't need to feel this way.
Yeah. Thank you both for joining us on today's episode. Very important messages for people to hear, and thank you both for your incredible work.
Thank you, Julie.
It's Mental Health Matters. I'm Julie, and thank you for joining us for today's episode.
Hello there. This is Karim Mamdani, and I'm proud to introduce myself as the President and CEO of Ontario Shores Centre for Mental Health Sciences. Thank you so much for tuning into today's episode and for joining us in these important conversations about mental health. I just wanted to take a moment to express sincere appreciation to the incredible team at Ontario Shores for their exceptional work. Our team of compassionate and skilled clinicians and staff work tirelessly to provide life-saving treatment and unwavering support for our patients and their loved ones who are facing the challenging impacts of mental illness. At Ontario Shores, recovery is possible and there is hope. I invite you to visit ontarioshores.ca to learn more about our work. On our website, you can explore our career and volunteer opportunities, learn about our programs and services, and find out how you can make a difference through donations.